Okay, recently there have been a lot of very hot topics other than the ones that are COVID related, that are non-COVID related. So first of all, we know about the black code that we are now on, whereby a lot of junior contract doctors are on, in a way, strike because they want to demand for permanent posts. And if some of you do not understand what is this all about, and what does it affect you, in fact, it affects all of you. It affects all Malaysians. Because when you are on contract post, they will never be able to go into the master's program. And you must understand that most of our specialists in Malaysia, they gone through master's program. So if you do not have enough doctors to go into the master's program, there will be a certain period of time that will be very, very short of specialists, because we churn specialists out batch by batch. That means, like, if you graduate this year from medical school, after maybe 4 or 5 years later, you will get into the master's program. So, but the new doctors have problem getting into a master's program because they are no longer in a permanent post, so they will not be given a master's program. So by the time UCs will have so many vacancies for masters, but they have nobody who can qualify to apply, and then it becomes a problem because, number one, maybe the places are not filled up in the UCs, or number two, because there are so few people who apply, so at the end they may end up just taking everybody, and then the quality of the specialist may not be as good as it used to be. So it's not really a good thing. So for all of us, actually, for all Malaysians, something needs to be done. And this issue, actually, we already foresee. We already foresee since a long time ago. We are, as doctors from the Medical Association, we have been always telling the government that you cannot go on producing so many doctors. The problem is Malaysia has been producing so many doctors each year, and this problem has been foreseen for more than 10 years ago. We already saw it coming. We saw it coming already, but unfortunately, no matter what we say to government, they didn't do anything. So it's good that somebody decided to go on strike. I think the government owe these doctors permanent post, because we already informed the doctor, and the government is already aware that we have too many doctors every year graduating from the medical schools, and yet they did not close down the medical schools. So I think the government do owe these doctors a permanent post, because it's they who did not close down the medical schools. So let's hope they got what they want. Okay, now going back to the topics I want to talk about today. Last week I was about to talk about COVID-19 vaccine with fertility, but this news came up that I wanted to share a bit. It's about the baby switching issues. Baby switching is something that came into the news recently because of a pair of twins. Luckily, they were identical, and then when they switched, they saw another person 19 years later, 17 years later, when they met in an inter-school meet, and they realized that the other person is like identical to this person. Some of the friends realized that this particular girl in this school looks exactly the same as her own classmate in this school. So that's how it all started. And after all the DNA tests done, it has been proven that the baby has been switched. And it's because it's identical. Can you imagine most of us who just give birth and then bring back a baby, and God knows whether the baby is ours or not? Unless you purposely go and do a DNA test, but there is no way you know. And incidentally, when I look back, I used to work in that particular hospital when that thing happened, because it happened about 20 years back, and in 20 years back, I was in Kota Baru, and I was working in the labour ward as well. But to tell you the truth, the labour ward there is crazy. It's crazy. It's a madhouse. People deliver like every minute. You know, Kelantan people 20 years ago, they used to have like 20 kids, 20 kids. My patients record, one lady gave birth to 24 children. That is the number of people, the children they give birth, and you can imagine how busy the labour room is, how busy the labour ward was. But of course, that's not an excuse to switch a baby. But the question is, could we have prevented all these things? Honestly, in these past 20 over years that I've been working, other than reading the news about cases of babies being switched and found out very much later, or babies being switched but found out not too long later, even in my day-to-day work, I have encountered certain cases where we discovered early. We discovered early, it didn't come out in the newspaper because we discovered probably like few hours later, the mother realized something wrong, this is not my baby, and things like that. It has happened even in private hospitals, So honestly, is this thing preventable? It's totally preventable. Unfortunately, there is no drive to prevent it. Nobody is bothered to prevent it. There is no drive from every aspect. The mother's aspect, the parents' aspect, the hospital aspect, the administration aspect. People are not motivated to prevent this because it is already well written in policies that are made by WHO, World Health Organization, that you're not supposed to do what we're doing today. But unfortunately, we are still doing what we are doing today. And that is why babies are still being switched. So this case happened 20 years ago, where some of the policies may not be so well established, but now, today, all the policies are very well established. But people are not bothered. And what am I talking about? There are two things that we could do. You ask me, there are people who try to do it by tagging more things. They wear these pink tags and white tags and blue tags on the baby's hand. It's usually pink or blue tags. Okay? They can wear on the hand, they can wear on the feet. But unfortunately, to wear this tag, I have to put one finger in before I can clip the tag. So if my one finger can go in, there's enough space. So this tag is very loose and the baby's hand is so small. These tags can just come out easily. It has happened so many times in the hospital. The tag came out. Oh, tag came out. I put it in. Or sometimes you find some tags on the floor. Whose tag is this? Then look at the name. Oh, which is the baby? I put in. These things happen every day in, day out in the hospital. How to prevent this from happening? How to prevent switching babies from happening? It's very simple. Never allow the baby out of your sight as a parent, not a single minute. And these things have all been well written. Babies born should be immediately put skin to skin on the mother's chest, not taken away to another place to dry and do suction and do whatever you want and then only bring the baby back. No, that's not right. The baby should be on the mother's chest. Even if you need to do something, the suction, the giving oxygen, the drying the baby should be done beside the mother's bed. Like the mother's bed is here, we should have the baby cot or the baby's resuscitation bay beside the mother. It should be. Okay, tell you, number one, most private hospitals, I've not been to all private hospitals in the world, but most private hospitals would have this beside the mother. But not many government hospitals. That is again budget issue. We don't have enough, so we share. So we take the baby away. The parent don't get to see the baby. God knows what happened. After that, they bring back another baby. Is that your baby? That's the question. So number one, babies should not leave the side of the mother at all time. So after birth, baby should be on the mother's chest. If necessary to do anything, actually, if by policies that have been made and written by world bodies, even if you are supposed to dry the baby, to do suction, do whatever, you can always do it on the mother's chest. You don't need to take the baby away. But if, let's say, you want to do the best thing for the baby, you take the baby away, but beside the mother, so that the baby is always beside the mother. That is the first policy. The first thing that hospitals should change. Second thing is rooming in, full rooming in. Rooming in is a well-written policy for even the entire Malaysia, but it's mainly done only in the government hospitals. In government hospitals, mostly, we have already got rid of the baby nursery. No such thing as baby nursery. Babies should not be in the nursery. Babies should be with the mother at all time. So we put the baby cot next to the mother. So if you give birth in a labor ward with the baby on your chest, and always on your chest, and whatever the nurse wants to do to your baby, on your chest, and after everything, they push you out to the ward with you holding your baby, and later in your room, the baby is always beside you. There is no way the baby can switch. True, but there is a problem. In government hospital, no problem. They got rid of the baby nursery. So that has already been the policy. Same way if you have a surgery to have your baby, if you have a cesarean. The baby after a cesarean should be on a baby resus beside you in the operating room, which is not a problem, it's always there. But there's a one problem. They are always in a rush to take the baby out. That's wrong. The baby should stay in the operating room together with the mother at all times. And the baby should only leave the labor room, the operating room, together with the mother. Why isn't it done? What is the problem? Because they feel that one midwife have to stay with the patient at all times. What's wrong if the midwife stays with the patient at all times? Think about it. If you're going to private, you're paying like how much? Almost like 10,000 just for a cesarean. I think you deserve to have the baby with you at all times together with the midwife. Then the mother and the baby should be pushed out to the ward together. And in the ward, the mother and the baby should be together. And again, this has a problem. Government, no problem. Because they ask the mother to take care of the baby, they don't need to take care of the baby, save one job. But private is a problem. A lot of mothers, when they go to private to give birth, one of the reasons they go is because they want to rest. If you want to rest and you want to go to private because you want to rest, means the nurse take care of your baby, then don't blame the hospital when they switch your baby. Because things happen. These things drop out. They find some baby without they put in. No one knows exactly whether that's your baby. They didn't do a DNA test to check the baby. Because it's so loose when the baby moves, it sometimes just comes out. You can't blame the tag from coming out. We try our very best to make sure we put into the right one. But no one can be 100% sure. So you want your baby to be your baby. Never leave the baby out of your sight. So parent issue is also one. Because they want to rest. They want nurses to take care of their baby for them. But in government hospital, no issue. You take care of your baby. So your baby is with you all the time. That's safe. That is nowadays. But there's also another problem. Even if I have a mother that is my patient, because I educate my mothers on the importance of rooming in. Rooming in is very important for both baby and mother. It's not just for the tagging and switching. There's a lot of advantages of rooming in. But still, many private hospitals refuse to change that policy. Refuse. I have been fighting so hard. I lost. I fight and fight and fight. Also no use. They refuse to change even though I told them all government hospitals practice 100% rooming in. WHO, World Health Organization, said babies must be roomed in. Why are our hospitals not rooming in our babies when we know that rooming in is the safest for the baby and best for the baby? Why? For convenience. Because if the pediatrician want to check the baby or the nurses want to check the baby, it's always easier to have like 10 babies in one room and check at the same time than to go to each and one mother's room to go and check the baby. It's all for convenience. But this convenience means there is potential to make mistakes. Because things like this have happened, as I said, I've seen it so many times. A baby tag out of the baby's hand. But if it's in the same cord, we presume that's the baby's tag. So the tag came out, we just take, and then we just put it back into the hand. But are we 100% sure? And sometimes I tell you, I find tags on the floor. Oh, whose tag is this? Let's go and find which baby it is. So even though they try their best, even the cord, they label the baby's name, the hair, they put a tag, the leg, they put a tag. Some hospitals, they are so scared, so they go and tag 2-3 places, so you have so many tags on the hand and the leg. But still, things can come up. Minimize, yes, but still, things can happen. So, hospital administrators as administration, they are not motivated to have this policy, and hospital like nursing staff, medical staff also not motivated for this rooming in policy, and a lot of mothers as well because they don't want rooming in. So hospital also very scared, because you must understand it is a business. People come to private hospitals. Some mothers come to private hospital solely and solely because they do not want to take care of their baby. So if that is the demand of the customer, so the hospital also not there to follow what the government hospital is doing, but if they do that, maybe all the patients will leave the hospital. They will go to another hospital where they have a nursery. They will lose business. So nobody there to take that step. Nobody. So that is why in all private hospitals, you still have a nursery for baby. But in government hospital, they already got rid of it. But they just say, mother, take care of baby. And a lot of patients say, I don't want to go government hospital to give birth because I have to take care of my baby. I want to go private. So that is the whole reason why these things can still happen and will still continue to happen. So now we know that baby switching is totally preventable. Alright? And until now, I didn't hear any news from the hospital administration, because they mentioned that staffs that are involved will be notified and informed. But I've not got any phone call. I don't think I'm involved, but I was there. I was definitely there. And whoever is involved, I probably know her or him. But most of the time, baby tagging does not involve doctors, because we deliver the baby only. We don't tag. Taggings are usually done by midwives. And if there's any switching and tags that drop, usually in the nursery or anywhere else, is usually under the care of the nurses. So most likely, I think that's what they will be looking at. They were looking at all the nurses who were present at the time when the baby was born. Okay, so very high chance they were, the possibility of when they will switch is number one, either in labor room, because we noticed that the time of birth for all three babies were very close. Another part would be when they push the baby to the nursery, because these same three babies would have stayed in the hospital from the same day and went back on the same day. So over that 1-2 days in the hospital, anything can happen. Anything can happen. Okay? Even last time it happened to my own patient also. They brought the wrong baby to the wrong mother for breastfeeding. And it became an issue a bit because one is Muslim and one is non-Muslim. So you see, things like this can happen. But we discovered, because when the mother was breastfeeding the baby, the mother realized something was not right. And thankfully, she realized it early, and wow, okay, we discovered it. But we had to, have some problems to settle, because there are some issues between Muslim breastfeeding non-Muslim and non-Muslim breastfeeding Muslim. Oh my God, there were some issues involved. Alright, so now we know that could be prevented. So if you are going to be a mother soon, ask for rooming in. Request from the hospital. You have the right to request for full rooming in, and the baby not to leave your side at all time, because these are well-written policies from Ministry of Health. I don't think any hospital should deny you of that. Fight for it. Fight for it. Okay? Sujin mentioned, beside convenience, I think private hospital do earn too by having baby in nursery. If not mistaken, 300 per day. Oh, it's okay. We pay the 300 per day, but we want our baby beside us, because they pay is not for the nursery, it's for the cot. You say everything is by bed and by cot. Like for you, you sleep on a bed. It doesn't matter. It's a 2-bedded room, 4-bedded room. They charge you for the bed. Okay. Babies who are rooming in, they will still charge, because they charge you for the cot. Charge lah. But I want my baby beside me, because when baby beside you, a lot of job for the nurses. Anything you will press the bell and call the nurses to come. That's why it's a lot of job. Pay that one day cot and press that button. Okay, pay. Nurses are meant to do their work now. We pay, so we get the service. Okay. Boyce Lee mentioned, agree in rooming in government hospital. I had baby rooming in beside me enough. I had an emergency, even though I had an emergency Caesar, which is very good. But that's why even in Caesar, it should be baby with the mother in the operating room. And after finish operating, the baby should be on the mother's chest. and follow the mother. We usually put the baby either on the mother's chest or beside the mother on the bed all the way in the recovery area. That means outside the operating room, we will normally monitor you for half an hour. That time when we monitor you, your baby should be beside you. And when they think you are safe and stable, and then they shift you out, baby should follow you together to the ward. That is the perfect scenario. That is the perfect scenario, and when you have that, you don't worry people switch baby. You don't even bother whether the tag is there or not, because the baby is beside you at all time. So the only time the baby can be separated from you if your condition is not stable or when your baby condition is not stable. All healthy mothers and babies should not be separated at all time. Amy mentioned it happened to my niece. The baby's tag was too tight. Baby didn't cry. Then at night when I opened to see the baby's leg, one leg was purple color. Okay, so the tag was too tight. But the tag too tight, it won't come out. But most of the time the tag is not tight. That's why it come out. So you see, the tag system is not the ideal situation, but we don't have any alternative. So the best option is baby beside you at all time. Never separate. If they have to bathe the baby, they bathe the baby in your room in front of you. Why must take the baby out somewhere, don't know, go where and bathe? I tell you, baby bathing, you better make sure you are there. Because they usually bathe all the babies together. That's when everything can happen. So no. If you remember, I still remember when I was in government hospital, it's like, come baby bathing, they're all queue, all the baby bring and go and bathe. Baby should also bathe in the bathroom beside you. If you are in private, the bathroom is there in your room. Baby bathe in that bathroom. Don't go anywhere else. Carol Wong say, I like the baby beside me and always had it in government hospital. It calmed me and don't have to look for my baby around worrying something happened. Best thing, I can feed my baby in the bed while we both sleep. Yes. So that's why I say government already have rooming in. So why is it that in private, you pay so much and you don't get it? Ask for it, okay? You want your baby to be your baby when you bring home. Please insist on rooming in, yeah? Hannah said, Doc, I have funny story to share because we are scared of baby switching before. I always instruct my husband to put blue ink. Wow, interesting. She put blue ink as mark in our baby's foot before they leave the labor room and go inside nursery room. The nurses always wondering why our baby has this. They say it's difficult to remove. I mean, everyone can tag their baby wherever your own way. You can put blue ink, or what you can do is you can also just bring a ribbon and tie on your baby's hand or leg. Because when you tie ribbon, you can tie it a bit harder, but ribbon can also open lah. Maybe thread, we can tie the knot a bit better. Because when you tie, you can tie it a bit closer, not too loose. Because when we put tag, it's usually very loose. And that is why the tags always come out. You know, there are many ways. Or you bring nail varnish. I think nail varnish is very nice. Put nail varnish on the baby's nail. Wow, cool, man. Okay, I think that should be cute. There's no way they can remove the nail varnish. Just like what Hannah did, there's no way they can remove the ink. And as a result, their baby will not be switched. Alright, so, okay. It's so wonderful that most of your questions end at 10 o'clock, ideally. Okay. One last thing, so as usual, whenever it's COVID, there's endless questions. So thanks for all your questions. I love questions because questions give me chance to understand what you really want. So before I end this video, as usual, I want to introduce to all of you, if you have missed any of my previous video, do visit my YouTube channel, Dr. Tan City Clinic. Okay, remember to subscribe, to like my videos, and switch on the notification button, yeah? Okay, so that's all for today, and stay tuned again next Sunday, same day, same time. Bye bye.